This research rundown is going to be a heavy one. This is a evidence brief that was conducted by the Veteran Administration, or was prepared for the Veteran Administration. It's entitled Hyperbaric Oxygen Therapy for Traumatic Brain Injury and/or Post-Traumatic Stress Disorder. And there's a lot in here, and it's something that we need to unpack. And let me start with this. My experience with the VA, and I think for many veterans, there's a variety of feedback that we get in this medical world regarding the effectiveness of the VA. But one of the things that you would notice going to a VA hospital, and some of the really large ones that I have witnessed, I'd like to point out. And so let's just open this up and let's see what type of evidence brief they put together here regarding hyperbaric oxygen and its effectiveness on the traumatic brain injured PTSD veterans. And so in the table of contents, one of the first things they do is they talk about the UHMS, which essentially drives the FDA clearance for hyperbaric oxygen therapy for a variety of indications, conditions. And it's also where CMS follows as far as what insurance will cover for hyperbaric oxygen. So when you look at the indications that they've listed, you'll find there's 14. And one of the central things that stands out to me, and you find these wound care clinics in hospitals, I want to say there are more than 1,500 in the US, is they use hyperbaric oxygen and treat non-healing wounds. And so then the question comes up is, the study starts with that, and you go to the VA, and one of the things you may notice is that the front parking lot is nothing but handicapped spaces. And at least I've noticed that in the one that is in Durham in North Carolina. And so the Durham VA has hundreds of handicapped spaces. And so why is that? And so we understand why there would be handicapped spaces connected to wound care, and understand how many veterans that have non-healing wounds where 1,500 hospitals are doing hyperbaric oxygen treatments because there's 40% less amputations. That's why it's approved. So if you look at the research that got this indication cleared, you'll find that 40% less amputations. Why aren't the veterans getting that same standard of care? That's my question, okay? So it points it out, and I think it's great that this study points that out. And I believe that when you look at traumatic brain injury, it's really, from many of the experts, they point out that that really is a non-healing wound in the brain, causes inflammation, and persistent chronic inflammation possibly is the cause of PTSD. So that's where it starts. I've looked through this. I would tell you that there's 103 studies that are excluded. There's some 13 that are included. We need to look deeper. We really need to understand, why are they excluding all these studies? There's a foremost expert in the field who they accepted one of, I think, 6 studies that are listed here. That is Dr. Harch, who's down in New Orleans in Louisiana. And so that's alarming to me that they're not including his studies, that they've removed that. So we're going to take some time. We're going to look deeper into this. And so look for that, come back. I'm going to do my absolute best to get Dr. Harch here in the studio so that we can get questions answered and we can get to the bottom of what this is about, because it's pretty clear if it's been approved in these areas. Some of the conclusions here, I think, are going to alarm you. And the dots are just not connecting. So please come back and we'll dive into it a little deeper. Thank you.